I was originally drawn to anthropology because I've always had sort of an interest actually in medicine, and at the end of my freshman year of college I went to Guatemala for a medical sort of medical mission trip with a group of students from UCLA, and was really surprised by the kind of design of the program and the lack of sustainability. And I found myself a bit frustrated with that, and so I wanted to learn more kind of about the preparation that goes into these type of programs, and if there are sort of more sustainable programs out there. So that's kind of originally how I got interested. My name is Rachel Mernoff, and the title of my project is Perspectives on Global Health, Analyzing Multi-Institutional Medical Practices in Lilongwe, Malawi. My project is looking at a global health partnership in Lilongwe, Malawi. And so over the course of the past 8 years or so, the UCLA Department of Medicine has been sending a large group of doctors, both attending physicians and residents, to this one hospital called Partners in Hope Medical Center. And I was looking at how the presence of these doctors from UCLA influences the practice of medicine at this hospital. So essentially how my project ended up playing out is that I conducted a series of semi-structured interviews with all of the majority of hospital staff who were working at this hospital in Malawi. So I interviewed Malawian doctors, clinical officers, nurses, patient attendants, researchers, and learned about their perspective on the partnership, areas that maybe they didn't like as much, but also areas that they really enjoyed and things they liked about the program. So yeah, it was a big variety of things. I think one of the most significant things I experienced was I was interviewing an HIV/AIDS counselor, sort of like a social worker, who was working at Partners in Hope. And at the end of my time working at the hospital, he told me that he was writing this book about Christianity and HIV care, and like ways that he hopes his patients and potentially other counselors can integrate Christianity into their like distribution of care, and sort of how HIV care is received in Malawi. And he needed someone to help with the grammar for his book. He just started learning English like 6 months before I met him. And I came from like a very liberal Jewish household where science was very heavy, and like sort of you didn't mix religion and science so much. And sort of like given the current political climate in the United States and how we often think about religion and healthcare interacting, I was a little sort of like skeptical about like putting myself into the project and working on something that I didn't necessarily connect with that much. But I realized pretty quickly that he had helped me a lot with my project and provided all this like incredible information about the program, and I owed it to him to just help edit some grammar on the documents. So as I was going through, I realized like it was just my job to help him with what I could, but I wasn't there to say what my kind of beliefs were about the program or anything like that. So there's this saying that I talked about earlier in anthropology that like you're supposed to make the strange familiar and the familiar strange, and I really kind of kept that running through my mind throughout the program, and especially sort of in this instance.